Hi Medical Squad, my name is Jacqueline and welcome to my channel Medicalology. Today I'll be discussing the first exam of Term 5, MNI. MNI stands for Musculoskeletal, Nervous System, and Infections. This module is roughly 5 weeks long and it's a lot of information. In this video specifically, I will only cover MNI and I'll go over CPRH, GOER, DNPR, also BSFCR in a later video. I will list 5 high-yield tips to help you pass MNI. Tip number 1, and I want you to engrave this in your head. What is the purpose of Term 5? The purpose of Term 5 is to get off the island, guys. There's nothing else I would like you to think about. In order to pass Term 5, you need a 72.5, and if that's what you obtain, I'll be extremely proud of you. In Term 5, there's so many things going on. There's small group, B-line, BSFCR, clinical rotation, a presentation, OSCEs, and the list goes on and on. And yes, guys, I was upset in Term 5 because they put so much on our plates and we had so much to study. If you are an average student, I wouldn't advise you to aim for a 72.5. You know yourself well, so please go up into the 80%, okay? So you can be safe. I know students who failed Term 5 by 1 point, and I do not want you guys to be in that situation. So remember, the main goal of Term 5 is to get off the island. Tip number 2. Before I start listing my tips, I would like to let you guys know that MNI is such a great foundation for step prep. If you can incorporate your step 1 book and also try to not only study for the exam, but to look at the overall big picture. The big picture is for you to what? To sit for step 1 and prepare for dedication. If you know MNI well, it will help you tremendously when you are studying for step 1. And it will make your dedicated period so much easier. So back to tip number 2. The number 1 resource I would recommend for MNI is Sketchy and Physeo. I am a Sketchy queen and I love Sketchy. It helped me so much while I was taking my exam for MNI. If you didn't like the sketch in Sketchy, please go to Physeo and try it out. It had amazing sketches for multi-system. The HIV lecture was high yield on my exam. You need to know that lecture inside and out, especially about the gag protein and pole. Know everything. The life cycle is very important, and also knowing the medications and what inhibits and what step of the life cycle. To sum up tip number 2, please use Physeo and Sketchy and also incorporate it with your Anki cards. After you're done with your Sketchy or Physeo video, please put in your Anki card so you can review it. If you know MNI well, it will help you tremendously when you are studying for step 1, and it will make your dedicated period so much easier. This module is 5 weeks long, as I stated. Your cards would be extremely helpful at the end. Tip number 3 is for pathology. I would recommend bootcamp and B&B. The bone lecture is buzzword heavy, so if you know the clinical presentation, you would definitely get the questions right. For example, if they talk about osteoporosis and they ask you the labs for calcium, is it low, high, or normal? You should know that with osteoporosis, there's always a normal calcium level. So remember the key facts for each bone disease. So they have a location of the different bone tumors that is not high yield. Please do not spend your time learning about the different locations of the bone. Just remember how to key in the clinical presentation for each bone disease. We're still on tip number 3, but this is for neurology. I think you guys should have a strong foundation of neurology because of Term 2. They went in depth. But what you need to understand in Term 5, it's all about the pathophysiology. You don't need to draw out the circle of Willis. You don't need to know all of the blood vessels. You really just need to understand the clinical presentation of the patient. For example, if they ask you, there's a patient that has the worst headache of their life. What hemorrhage is that? It should be a subarachnoid hemorrhage. Say, for instance, a patient comes in, they have a skull fracture, and they lost consciousness. What hemorrhage is that? That's an epidural hematoma. So if you know the key symptoms for each disorder, you'll definitely get all the questions right. Bootcamp does an amazing job. If you haven't checked it out, please go ahead. In neuro, histology was extremely important. It came back to bite us. I didn't think that we'll see histology. If you see a histo slide in your PowerPoint lecture, please screenshot it and put it in your Anki card. They will come back. But one thing that I'll advise you guys to do is search up the same keyword in Google and look at different ways that they can present the histology slide. For example, the meningioma, knowing the different histology slides would be extremely helpful. The world pattern, go in Google and look up different images of each histology slide. Next, associations with Turner syndromes, Klinefelter syndrome, cystic fibrosis, whatever lecture that is under, please guys know the association. For example, for Turner syndrome, you should know the association of the horseshoe kidney, also the bicuspid valve, the coarctation of the aorta. You need to understand the association. Don't try to think about how they will ask you the question from term 1. It's not the same. They're trying to see if you can correlate the associations with the disease. For example, with Klinefelter disease, what is this patient at increased risk of having? That would be gynecomastia and also breast cancer. So that's the way that they're trying to ask you the question. Cystic fibrosis, they're not going to ask you about the CFTR channel. They're not going to ask you about the chloride, if it's going up or down. They're not asking that. They want you guys to know the association. And one association which is high yield is that they have nasal polyps. So make sure whatever that lecture is under, they have clinical features or association. Please highlight that. That will be very high yield for your exam. Tip number 4 is for DLAs. Again, yes, they will show up on your exam. 2 to 4 questions, and that can bring you up to an A or a B. What I advise you for DLAs is to go on boot camp and check if they have the topic. Tip number 5, last tip. Make a calendar for each block. I did it at the end of term 5 because I was ready to get off the island. I was doing so well and I knew I was going to pass, but I wanted to just cross out the days. But if you guys keep yourself accountable for everything that you need to do, I will put it right here. I made a calendar and I made sure I put when I wanted to end my content. I wanted to know when did I have beeline, when did I have time to study, when did I have OSCEs. I put everything in the calendar. Yes, you can use Google Calendar, but having the calendar and making it yourself just keeps you more accountable. Also, guys, I want to talk about Alzheimer's disease, Huntington's, Parkinson's, ALS. There's so many diseases that you're going to learn for MNI, but guys, keep in the big picture. Please know the buzzwords. They have to give you the clinical presentation. If they give you chorea, if they give you cogwheel rigidity, if they tell you about ALS and they want you to know if it's motor, motor and sensory only, you should know that ALS is only sensory. Okay, guys? Remember to understand what is high yield regarding the disease. It's not tricky. They're just trying to prepare you for step 1. Well, this is the end of my video. Thank you guys for watching. If you have any questions, please reach out to me on Instagram or my email. Please like, comment, and subscribe. If you have any other questions, please drop it below in the comment box. Bye.